26 million people in the U.S. are currently uninsured. Clinics like Bethesda Health in East Texas, they provide health care services at an affordable price for adults and children who don't have insurance. But the number of patients has increased, and there is a plan to expand their clinic. It's in the works. KLTV7's April Peardon shows us what they're doing.
Thank you for calling Bethesda.
A health clinic in Tyler, Texas, provides services to adults without health insurance for the past 21 years. And for the past year, they've extended their services for children as well.
And we wanted to have a place where people could have just a small copay and come and get services, not let cost be the issue to getting the health care that they need.
Where an office visit can cost as low as $20 or $30 for adults and children. But in just the past few years, the demand for their services has increased with the number of patients.
Just kind of running out of room.
In 2023, 16.3% of Texans are uninsured. That's just less than 5 million people and more than double the national average.
More people are coming here. More companies and individuals are having harder times, so it's getting more difficult to get insurance or to get insurance that will help them when they need it.
And with the COVID-19 relief funding expiring this year in 2025,
we anticipate that there may even be growing needs in the near future.
For many patients, like Hope Bremer, mental health is a big one.
Just to see a psychiatrist, when I called other places, they want $500, and there's literally no way. Same with rheumatologists. There's no way I could afford it. I could afford something like that on my own.
Over 40% of Bethesda's funding comes from the community alone.
The community comes and continues to back us. We'll be able to have future options for our patients as well.
Part of that community support is future works on expanding their facilities to help serve more East Texans, one at a time. April Peardon, KLTV 7 News.
Bethesda is hoping to expand their facilities, as I mentioned, within the next year or two. We'll keep you posted.